challenged to find new and innovative ways to
44 is more than I thought we would get, honestly.
And I think as a result of
Hey, it keeps trending upwards.
And
so
no
we're not losing
negative
a bunch of people,
comments.
so that's
Right,
good.
yeah.
Not like 44, 28, now we're down.
I think it was the beginning of suspension. They were just
Well,
Is it going to happen?
I don't know if I've ever been waiting for a live stream this entire quarantine that started on time. Ever.
true.
Like,
Yeah.
you know, there was a live auction yesterday that was supposed to
Hello,
start.
I'm Kayla
last night,
Monfort,
but it
co-director
didn't
of
start this
Activate
morning.
Allen
You know,
County.
like that
I
kind
don't
of-
know.
I'd like
that,
to
though. I'm
welcome
really
you this
sorry about that.
afternoon and
Oh,
thank you for
yeah,
taking
sorry.
some time out of your
It's
busy
okay.
schedule to join us as we talk about a very important topic,
We were just assuming
the health
different
of
things.
Allen
Yeah.
County. Today, we will briefly touch base on a variety of successes and also future goals from our Community Health Improvement Plan. For those who do not know, the Community Health Improvement Plan is a way for our county to track progress within a wide variety of health initiatives and encompasses community data and the work of many organizations, groups, and stakeholders throughout the community. The plan is important because it shows the collective nature that we need to take when we approach community health. When we all work together down the same continuum of health, great things can happen. To get us started today, I would like to introduce Mr. Bob Cupp, Ohio's Speaker of the House.
I'm Bob Cupp, Ohio's new Speaker of the Ohio House of Representatives, and I'm pleased to join today's event and to welcome you to this 2020 Activate Allen County Community Stakeholder event. You know, much has happened since last year's event because of the COVID-19 pandemic. There probably has not before been in living memory such a broad public understanding of the need to stay healthy. The Lima-Allen County Chamber of Commerce is to be commended for continuing to hold the community stakeholder event in spite of the present health circumstances. It's evident that community health and the health of our citizens have never been more important. As of December 7th of this year, there has been nearly 500,000 total COVID cases in Ohio alone, and cumulatively, nearly 30,000 Ohioans hospitalized, and a total of 7,000 lives lost in the Buckeye State due to COVID-19. The virus has, of course, impacted lives in many related ways, too. These include increased depression and emotional distress among citizens, both young and old, a tragic correlation between increased unemployment rates and increased suicide rates, and increased drug overdoses, alcohol abuse, and domestic violence. There is no doubt that COVID-19 pandemic has had an enormous impact on our workplaces, schools, faith-based institutions, and throughout our society. And all of this is on top of the health conditions and chronic diseases that were present before, such as coronary heart disease, stroke, diabetes, cancer, COPD, and arthritis. To tackle healthcare and public health issues, it's important that all sectors of our community collaborate and plan together for ways to achieve a healthier and better future. That's government, businesses, nonprofits, and citizens who all play important public health roles. And Activate Allen County has a significant role in this effort. Local plans, like the Allen County Community Improvement Plan, help create the foundation that supports the state of Ohio's State Health Improvement Plan. And working together at a local level is an excellent way, and truth be told, probably the most effective way to ensure that Allen County residents have the opportunity to live healthy and productive lives. So, thank you for linking in today to learn more about plans for the health of Allen County.
Thank you very much, Mr. Cupp. Hello, I'm Josh Underbrink from Activate Allen County. Before we begin with our presentations, I want to encourage everyone who is watching live on Facebook to please ask any questions that you may have in the comment section and answer the survey questions that will be posted throughout the video for your chance to win Lima-Allen County Chamber of Commerce gift certificates. Now, I would like to introduce Tammy Colon from the Mental Health Recovery Services Board of Allen, Auglaize, and Hardin counties.
Thank you, Josh. I'm Tammy Colon from the Mental Health and Recovery Services Board of Allen, Auglaize, and Hardin counties. The Opioid Action Commission was established in late 2016. The purpose was to engage leaders in the oversight and promotion of a community-wide effort to tackle the opioid epidemic and suicide, as well as energize the community to embrace prevention. Why do we need to tackle those two social concerns simultaneously? Suicide is the leading cause of death among people with substance use disorders. Compared with the general population, people treated for alcohol abuse or dependence are at about 10 times greater risk for suicide, and those who inject drugs are at about 14 times greater risk for suicide. The goals of the commission included withdrawal management centers here locally, which has been completed through St. Rita's Medical Center and the We Care Regional Crisis Center. Student and parent education has been completed through the Let's Talk campaign. We have several recovery homes in our community. Project Dawn has been implemented in our community through the Health Department and Coleman Professional Services. We have quick response teams of peers that are responding to emergency departments for overdoses. We are recruiting more physicians who are willing to assist us in this battle and provide medication-assisted treatment to individuals with addiction. We are monitoring prescription practices through the OR system. We have prevention in all of our schools. We're monitoring drug overdoses community-wide through the epicenter that we receive the information from the state of Ohio. Why do we need to re-energize the commission? Because drug overdose deaths did decline by 5.1% in 2018. However, the CDC is reporting that there will be more deaths in 2020 than previously recorded in 2017. Only 55% of those who need treatment for heroin use disorder and 21% of those who need treatment for prescription pain reliever use disorder get treatment. Suicide is the 10th leading cause of death in the United States. It is the second leading cause of death for ages 10 to 24. The Opioid Action Commission will be establishing new goals to help promote the health and well-being of our community. Currently, the following are areas that require intentional effort. We need to increase prevention and education among our youth with an intentional focus on our minority communities who are 2 times as likely to attempt to kill themselves. The rate of increase of Black African American drug overdose deaths is 25% compared to the overall population increase at 11%. We need to recruit and retain qualified behavioral health specialists and reduce secondary trauma stress on those who are currently providing care in our community. We must increase Narcan distribution in our community to save lives. And we have to get creative and develop additional harm reduction programming that works for the people in Allen County. And now I'm passing this off to Rhonda Lehman with Mercy Health.
Thank you, Tammy. Hello, my name is Rhonda Lehman, and I'm the president for Mercy Health St. Rita's. Chronic disease and obesity are both serious issues for us here. As I think about some of the ways that we've been able to work with other agencies, one of those is through the Activated School Challenge. The Activated School Challenge has been an opportunity for us to partner with area schools to create both initiatives and new programs that help kids get active from a very young age and learn about behaviors that are going to help improve their health for a lifetime. In addition to that, we've also been key supporters for the Go Noodle program. The Go Noodle program is an innovative opportunity for kids to have both mindfulness as well as some body movement, again, instilling on them that learning can be fun, can be movement-based, and helps create good patterns of behavior. In addition to those areas, we've also been able to work with agencies to create more walking paths, more bikeable areas. In addition to that, we've had community gardens. We're very proud of the farmers market each summer. So those are just a few of the ways that we've been able to contribute, but we also recognize that we couldn't have done those things alone, that being a part of Activate Allen County has really allowed so many of us to come together, not only to care for those who need us when they're sick, but also really to work on the preventive side of healthcare. And now I'd like to introduce Sharita Smith.
Thank you, Rhonda. I'm Sharita Smith from the City of Lima. In 2019, with the support of Lima City Council, we hired a consultant to provide an assessment of Lima's housing challenges. The assessment involved public input through surveys, interviews, working meetings, and an assessment of prior studies and current programs, and produced a 70-page report on housing in Lima, including opportunities, challenges, and a broad set of recommendations to meet those challenges. The report also reached some factual conclusions. Safe and decent housing is a priority for Lima citizens. Income isn't keeping up with housing costs. We have a problem with blight, And by 2030, we need an additional 1,175 homes. What the report did not provide was an implementation plan and consensus from the community around getting that work done and establishing agreed upon priorities around what to tackle first. The work of the Housing Task Force will be focused on building that consensus, establishing those priorities, and providing an implementation strategy that preserves and creates a range of housing options to meet the needs of Lima's homeless, low-income, middle-income, workforce, and market-driven housing demands for the next 10 years. Housing for all. We have to be competitive with other communities in terms of overall quality of life, and housing is a big part of that. We have to be honest about where we are, honest about what resources we have, and decide as a community how we are going to move forward together. One of the previous CHIP goals was to control the use of tobacco in our community. Nearly all smokers start as kids or young adults, and these age groups are heavily targeted by the tobacco industry. As of October 17, 2019, it is illegal to give, sell, or otherwise distribute cigarette, other tobacco products, or alternative nicotine products like e-cigarette, vaping products to any person under the age of 21. Increasing the tobacco age to 21 helps prevent young people from ever starting to smoke and to reduce the deaths, disease, and health care costs caused by tobacco use. And now I'd like to turn things over to Kathy Lund from the Allen County Public Health Department.
Hello, I'm Kathy Lund, Health Commissioner for Allen County Combined Health District, and I appreciate the opportunity to meet with you today. First, I want to address the elephant in the room. The very fact that we're coming together through this virtual event is evidence of this new reality as we all live through a pandemic. The COVID-19 pandemic has certainly brought new attention to public health and the health of our community. As your local public health agency, our mission is to protect and promote the health of Lima, Delphos, and all of Allen County. Living in a world where this new coronavirus exists brings together a unique blend of those two critical public health roles, protecting and promoting our health. Today's structure of public health in Ohio has its roots in the aftermath of the 1918 worldwide pandemic. Protecting our community from communicable disease was a focus of public health in the early 20th century. As infectious diseases were brought under control through such measures as antibiotics and vaccinations, the focus shifted to health promotion, and we emphasized education to encourage people to make healthy choices to combat what had become the new major killers: chronic diseases like heart disease, diabetes, and cancer. We encouraged people to quit smoking, choose healthy foods, and exercise more, with somewhat limited success. Something we've learned over the years is that individual health is so closely linked to our community and the health of the community in the environment in which we live, learn, work, and play. While we think about where we live, learn, work, and play, it's obvious that the pandemic has had a huge impact on all aspects of our individual health: social, emotional, economic, mental, and physical health, not to mention the overall health of our community. Sending school children home for distance learning has many unintended effects that impact safety, nutrition, and psychosocial development, just to name a few. Adults have had their work routines interrupted, and jobs lost, and certainly our local businesses have been impacted. I tell people that the reason we have the word pandemic is because a pandemic is unique. They're huge, and they disrupt almost every segment of our society. Resiliency and recovery from the pandemic are critical aspects as we move forward. Another feature of a pandemic is that they highlight and exacerbate community conditions and issues that already existed. For example, the overall health of individuals in our community. Words like quarantine, isolation, and social distancing have become part of everyday conversation. Nationwide, there have been increases in suicides, increases in the number of people using drugs, more people reporting symptoms of depression and anxiety. This is certainly not the direction we were heading before. One aspect of health that has been part of the conversation around COVID-19 is the role that underlying health conditions play, as some conditions put people at greater risk for complications from the virus. We know from our community health assessments that Allen County residents have high rates of chronic disease such as obesity, high blood pressure, heart disease, cancer, and diabetes. We also know that certain segments of our population are more likely to have chronic health conditions. For example, our data tells us that people with lower incomes are more likely to have many of the high-risk health conditions for COVID-19. Race is another area where we see disparities. Existing social and economic conditions also play into this equation. What this means is that the pandemic impacts different segments of our population differently. Many of these health disparities are being magnified right now. During a pandemic, those at higher risk generally do not fare as well as those with optimum health. We are definitely seeing people who are Black being disproportionately affected by COVID-19 here in our community. Did you know that in Allen County, Blacks make up 12 to 13% of our population overall? Yet they represent 25% of Allen County residents who have been hospitalized due to COVID-19. Others at high risk include the homeless, the uninsured, and people with behavioral health issues. Nothing about this pandemic has been ideal. Our community has faced challenge after challenge, and it's not over yet. However, we can see success. We have strong partnerships in place in our community, and we've already acknowledged that no one organization can address the health issues and disparities we face. Public health is the prime responders for a pandemic, but we can't address all of these impacts of a pandemic by ourselves. With something of this magnitude, we have to rely on our partners. Our success is that our local businesses, agencies, and organizations have stepped up to do what they do best in serving our community. The pandemic has reinforced just how much we need the support of each other. A coordinated and collaborative response is the only way our community is weathering this COVID-19 storm, and it's the only way we'll continue to make progress toward our ultimate goals. While we are all busy responding to this pandemic, it's good to know that we haven't lost sight of our community goals. We are still working together to protect and promote the health of everyone in our community. 2020 has been a tough year. We've lost friends and loved ones. We've faced scary times and new challenges at every phase of this pandemic. And I know it's not over yet. As we approach the end of this year, we all look forward to the promise of 2021 and the years to come. We are going to get through this. We're going to get through this together. At this point, I'm happy to turn things over to Derek Steeman to share more about our vision for health equity, when everyone has an equal opportunity to achieve optimum health, whether it's our everyday health or a once-in-a-lifetime pandemic.
Thanks, Kathy. My name is Derek Steeman with United Way. So far, you've heard a little bit about where we've been and what we've been able to accomplish over the past 3 years. And now I have the distinct privilege of pointing us to the future by sharing about where we are going and what we hope to accomplish together as a community. You know, this year has been a year like no other. No matter who you are or what business or organization you represent, all of us have been challenged to find new and innovative ways to provide services to the community. And I think as a result of this process, it has exposed areas in all of our businesses, organizations, and even communities where we need to and can do better. One area that we see this to be especially true is around the area of health equity. You see, we believe that everyone should be given a fair opportunity to live a long and healthy life. But often many individuals in our community face barriers that hinder or prevent them from having this opportunity. And I don't want us to get health equity confused with equality. The main difference in these is that equality has the assumption that everyone will benefit from the same level of support or equal treatment, as you see in the diagram before you. But equity takes it a step further. To get everyone